Then we are just talking about the orthopedic world. How in your opinion, poor care in orthopedics parallels poor care in non-orthopedic medicine?
Yeah, I think what's kind of unique to my understanding of MDT is how much it's influenced from me being a patient in the United States. I mean, I was a patient a little bit in Korea when I lived there, and I want to do a post about this. When I lived in Korea, I had really bad knee pain, and my x-ray cost $2, right? Like that's probably what it costs like in Brazil, right? So we know that there's different things out there, but I had experience being a knee pain patient in the United States. And then I've had, obviously my back episode. And then I've had a lot of experience being a patient in non-musculoskeletal care in this country, unfortunately. And whereas at first I kind of, I wasn't fully into MDT, I didn't see its value until after a couple of years of really getting good at the system. But now I just see how the refusal of kind of accepting MDT is what we're doing in the rest of medicine. I've been to so many different doctors, but I went to one doctor who, took a brief history where she wasn't really asking specific questions that I think would actually like lead her diagnostic mind in different directions. And she's like, okay, let's get a picture. And I was like, okay, we'll get a picture of X, Y, Z. And then on my second visit, she's like, okay, well, the picture's negative. So I think your problems are just due to stress. And like, I almost lost it, because I was like, this is proof to me that it's not just musculoskeletal care, orthopedic care, it's all care in the United States. Like they just so focus on structure, right? And they don't ask the right questions. And if they don't understand it in a visit, they like make up something about how I'm having all these symptoms because of stress, which is like ridiculous and offensive, right? And angering and makes you really sad. And I just like having gone through that experience for years, I just see like, yeah, like that's what we're doing in orthopedics. And that gives me further kind of drive to counter that and be like, orthopedics is focusing on structure with imaging as well. And then they want to make things, central somatization, I can't even say that word, or, chronic pain syndromes. And I think, yes, those exist in people. I think they exist in the other population, which is why I'm, trying to study more about pain neuroscience education. But to lump people into that without giving them a proper, mechanical evaluation, or what I would say just a good orthopedic evaluation, is just really doing them a disservice, because we have MDT studies that show, cohorts of people who have had pain for decades are mechanical, right? And so I just get further, like I said, further kind of aware of the power of MDT when I see like, oh yeah, it's the same thing in orthopedics as other things. Like we're just focusing on structure and muscles and things we can see, and we're not understanding that pictures can be helpful in some cases, but they're not telling you how the body is functioning. And MDT really stresses that most problems are functional, right? Joints not functioning right, joints that are structurally sound that are just not functioning right, tendons that are structurally sound or maybe a little bit, a few changes on ultrasound or MRI, but they're fine, they're just not functioning, right? And when you take joints and tendons that don't function well, that's 85% of orthopedics, right? I mean, you're not getting ligament tears and muscle tears and fractures in a lot of people, right? You're getting them more in highly active or athletic populations, but you're just not, right? But we're finding all those little things on images and just giving people the wrong diagnosis to start with.